Hello, thank you for all being here. My name is Pei Wen. I'm a medical science doctor and actually I'm a nurse too. I'm so glad that to have this opportunity to share a smart care for nursing system with you. And today my topic is design and implementation of model-driven development for nursing information system. I hope that after this talk, we should think more about how to improve the healthcare system and do it smartly. My presentation includes 4 parts. The first part is about introduction of nursing care. Next, there will be an introduction about this study, method, result, and conclusion. So, let's elaborate more about the relationship between the patient journey and the nursing information system. By showing this slide, you can see main screen. And actually, we have adapted different models of patient's journey in Taiwan and overseas hospitals so as to take it ideal and more user-friendly when using the nursing information system. As you see, from left to the right, different functional buttons is laid out here, from admission to discharge. On the other hand, nurses can use the NIS to facilitate their clinical care across departments. They can submit laboratory X-ray requests to related departments based on the doctor's prescription, or to create referrals to other health departments, or even create transfer summary for handover patients to next caretaker. In fact, current healthcare industry are more focused on quality, efficiency, and safety. Different countries are also promote the idea of smart hospitals, whereas some smart hospitals rely on the sharing and the use of information as well as the communication between all those technology-based environments. As such, mainly to establish the nursing information system for those clients. This NIS program can consolidate and streamline the clinical workflow, created various kinds of medical records with accuracy, shorten the period of time in managing patient schedule and information, so that the clinical staff can spend more time on patient care. Besides, NIS is designed to alert different users for any abnormalities based on their clinical assessment so as to improve patients' outcome. Apart from this, during COVID-19 pandemic, nurses are required to wear personal protective equipment all the time. Sometimes they feel difficult use keyboard during their clinical work, so they can use the voice assistant to access the NIS and to open various records. To sum up, NIS system can make the healthcare system become smarter in terms of the following advantages. First, NIS is a program that has a comprehensive nursing process loop, and yet we have really tried to integrate the daily activities of nurses in this system. Staff can complete many clinical assessments and get the work done by their data entry. For example, for risk, nutritional assessment, intake and output record, tubes and drains assessment. After finishing all these assessments, NICE is able to provide clinical alert based on the underlying settings. This is an enhanced function, and that alert message is tailor-made based on performance. It can notify the users and provide some suggestion messages, such as to take preventive measures or to consider other intervention or care. In that sense, it can facilitate this decision-making during the daily clinical workflow. Besides all the needs records and vital sign figures can be exported to the multidisciplinary progress note or other required documents. That means it minimizes the transcription in daily work, as well as reduce the nursing workload and the chance of transcription error. On top of this, we adapted evidence-based approach and develop different care plans and pathways so that these users can provide care that is protocol-driven. There are many different daily assessments and care treatment plans available in NICE, and they are all developed with evidence-based, such as pain assessment or pressure ulcer risk assessment. In this study, we expect to build a reliable, efficient, and flexible nursing information system through system design and core architecture. We will use the three-time model view controller architecture. JavaScript and HTML will combine to develop the user interface, and the web service will be used to exchange data with the hospital information system. In this program, the object-oriented programming design will be adapted to plan the encapsulation and the logic programming of all system applications, the related data, and the data processing methods. Another vital core structure is database design, which will adapt the master detail structure to further increase the flexibility in modify and maintain the nursing information system according to different requirements. Model View Controller (MVC) is a system design pattern that aims to rely a dynamic program design, simplify the subsequent modification of the program, and the expansion of functions, and allowing a certain part of the program to be reused. The V is view in MVC is responsible for user interface process, including the program logic for screen display. The C controller is responsible for receiving users' requests to the system, processing user input, controlling the program flow, and coordinate the response result of the model and the view. The M model is responsible for the intermediate program logic, data processing, and database operations. The view is responsible for user interface, including the display logic. It is divided into ordinary view and the partial view. The partial view in a certain view. For example, many functions in NIST are divided into different schools. For the view of full risk assessment, there will be partial view of multiple schools, such as stratified modes and hand-drip tool. The system can easily present the front-end screen according different hospitals or wards of different natures. The controller is responsible for receiving requests, processing user input, controlling program flow, and coordinating the response result of model and view. In this, the most commonly used controller is the view that transfers data to the front-end. Design is very important for the needs to have enough flexibility and scalability. Among the most commonly used admission nursing assessment items in many hospitals, there will be very different special assessment items according to different age groups or different subjects. However, the design framework of data tables will be the same to that there is no need to change the data tables because of different subject or different evaluation items. Under the software developed environment of high variability, high complexity, and high customization in the medical industry, a scalable and maintainable nursing information system is realized through the MVC architecture and the master detailed data table design, which can meet the needs of different organizations. This is developed and designed with a web-based MVC architecture, which clearly distinguishes the functions of each component and make it possible to reuse a certain part of the program, improve the scalability and the usability of the system. It applies the same set of business logic and the same database contents, and only needs a judgment of different front-end progress so that it can be presented in future systems on different devices. Unless there is a service rule change, only the back-end business logic or controller needs to be adjusted, while the rest of the front-end code can remain unchanged. In addition, it supports the integrated interface of hospital information system data and the automatic acquisition of hospital medical information. The web-based MVC architecture, it can be easily integrated with other web-based hospital information systems and provide the convenience of cross-platform usage. The feature of front-end program planning and design allow users with various devices, such as computer, tablet, mobile phone, and large-screen TV commonly used in smart world, to get a better visual effect. Since the contents presented by adapted from the system contents, it is not necessary to repeat update the system information at great cost. The input data storage price of any device is the same as the needs of the computer, so there is no need to perform additional synchronization, which save the cost database synchronize operations and avoid possible data inconsistency errors. It can receive clinical data from different clinical domains and display web page and the different forms of function from the browser of the device. There are 5 hospitals in Taiwan and 2 hospitals in Hong Kong implementation this system. Well, this is a real-life healthcare environment in Hong Kong. In this world, apart from the desktop computers, nurses are using different approaches to access the needs, including the computer on wheels and the tablet device. Thank you for your listening.